Hello. Perhaps you're asking yourself, what the heck is posterior cervical laminectomy with fusion? Hello, my name is Romuel Sabignano, and I would like to share with you my personal experience dealing with my diagnosis called stenosis of cervical spine with myelopathy. I will be undergoing a cervical procedure called posterior laminectomy with fusion on my C4, C5, and C6 vertebrae. Stenosis of cervical spine with myelopathy is a combination of various factors in my life, um, such as degenerative changes in my body brought about by the different events, including my aging, a busy and active lifestyle, trauma related to heavy sports, um, my work dealing with computers and cell phones. As you can see, um, I do this a lot on a computer, and so my neck is basically has run its course. All this contributed to the dislocation of three intervertebral discs that holds my spine as it moved in its place. Besides that, unfortunately, I belong to a few group of unlucky people that inherited genes where my body produces extra amount of calcium that develops bone spurs inside my spinal column and inside my nerve canal. Basically, this bone spurs causes the narrowing of the passages of the nerves inside the canal, the nerve canal, as they exit to my neck, onto my chest, my arms, and legs, which causes the numbness, tingling, and reduced sensation, and weakness in my arms and different parts of my body. It also affected my sense of touch, vision, my perception, mobility, and even affected my sense of balance as it causes dizziness and nausea, which is very problematic. I used to enjoy long walks in the park and a few hoops playing basketball, but due to my condition, which causes weakness and lack of control in my legs and arms, and lately I noticed that I could hardly walk less than 50 feet from my house. So my physician's advice is, besides surgery, is therapy, medication, chiropractor, acupuncture, exercise, and injection on my spine. All this I've considered and tried, but nothing could stop the shooting pain of the electrical jolt coming from the back of my spine that goes all the way to my legs. Every time I sneeze or cough or just clear my throat. There were also few instances when I felt dizzy and nauseated that I almost fell on the stairs in my house. After consultation with my physician on the procedure and its impact in my life on a long term basis, and after weighing the consequences of my decision to do it or not, within a month I agreed to undergo the surgical procedure called posterior laminectomy with fusion, where my surgeon will extract the bone spurs and the bone arch covering the back of my spine, called the lamina, to free up the narrowing nerve passages that is causing my symptoms. Of course, my immediate reaction was that I felt so scared and alone, not knowing what to do and what to expect. I even asked crazy questions like, am I going to die soon? Or will I become paralyzed for the rest of my life? What's going to happen to me and my family? There's a lot of questions twirling in my mind. However, with the comforting and assuring words from my physician, he said that the procedure is minimally invasive and that only takes a couple of hours to perform. And perhaps maybe within a day or two, I will be able to head home. The meeting with my physician was brief and concise, but I could not figure out any further questions aside from what was already discussed because somehow I guess I was in sort of a shock. As soon as I got home, I immediately went online to research and watch video documentaries pertaining to the procedure. What are the possible causes and treatments, and how long does it take, and what do I need to do from here on? In short, I was in a panic mode as my whole world started to spin, trying to figure out tons of possible what if scenarios. In my search on the videos online, I tried YouTube and found several videos pertaining to anterior procedure, which means in the front of the neck. But I found out there were only a few limited videos on posterior surgery similar to mine, and most of the videos I found were practically done more than a year ago. However, I still find that all the information I've discovered were very useful and informative. So with my frustration and anxiety, I decided to create and share this YouTube video of my personal experience as I undergo the process from pre-surgery to my post-surgical procedure to give others an idea on what to expect if and when they ever undergo this similar experience. I just wanted to give you, the viewer, an idea as to what I felt like and what I did when I decided to undergo the whole procedure, so that somehow you will have a positive perspective and a hope that the video will make you feel that you're not alone in this journey. Although each and every one of us have similar or identical diagnoses and procedures, but we all have a unique and different result or personal experience as our bodies may react differently to certain factors such as procedures, medicine, therapy, and all that. But to those who are undergoing this procedure, this similar to mine, or this particular procedure, or about to experience this wonderful journey for the first time like myself, do not be afraid. You'll do fine. There are literally hundreds and thousands of people in the US and around the world who have a similar experience to yours and mine. So don't worry too much. That's what I tell myself. Don't worry too much. Just have faith and trust. According to a study made by Surgical Neurology International on their patients, which ranges from 42 to 92 years old, with a median age of 64 years of age, that have undergone this procedure, they have concluded that this procedure is safe and effective treatment, as there's an average of 85.5 to 90% improvement after surgery on all the patients that they have made a study on. I hope that you and I will learn from each other as we literally slice through the important information that I'm about to share. Before I made my decision to undergo the surgery, I felt like I was stuck between a rock and a hard place. Because should I decide not to do the procedure, I have to suffer the long-term and short-term consequence, which is potentially fatal or perhaps to live a life filled with pain and irreversible impairment of my basic human function, which basically will render my body or myself as useless and causes depression. I heard from several friends of mine and acquaintances that the surgery is a must-have for me. Otherwise, I will have a very painful lifetime. Some people took years to decide before they had the surgery, and as a result, their nerves were damaged, that it took them a long while to recover, and perhaps they never recovered at all from their debilitating pain as a result of waiting too long, or perhaps they had a failed procedure. So my decision was practical and informed based on all the researches I've done, interviews I've done, books that I've read. I've learned so much from this journey, and I can say that my decision was practical and informed. And I can say I do not have any regrets at all. I figured out that if I were to remain, if I were not to decide on this procedure, and I don't want to live the remaining years of my life with this debilitating illness, I would rather take the chance of a positive and hopeful result, take the chance on the surgery rather than not take my chances and suffer a lifetime of definite pain and depression due to low quality of life. I'll give you a little history of this illness or this diagnosis. Back in November 2019, I initially felt this noticeable tingling sensation on my fingertips, which comes and goes initially. And I just dismissed it as being tired hands working on and cleaning the house, the backyard, and polishing the RV, and all that stuff. However, in December of 2019 and during the early weeks of January 2020, I did not feel any form of pain or sensation, as I just dismissed it as perhaps a fluke. So when I came back from my overseas trip in February, I went to my doctor for my annual physical checkup, and I complained about the feeling of a shooting electric current across my back all the way down to my legs. And so my doctor ordered lab tests and x-rays and MRIs. Looking back, while I was in Asia, I had an x-ray done by a local hospital because of my complaint of an irritable cold and sneezing. And I was told that I have an onset pneumonia. And the x-ray and the MRI results reflected bone spurs in my spine. I told this to my physician, so this triggered my physician from Kaiser to do tests and MRI exams. And there she concluded that I have cervical stenosis with myelopathy. My physician and I discussed several alternative solutions, including therapy, acupuncture, medications, and all that, but nothing really worked. So as the days go by, I started to feel gradually increasing weakness on my legs, as I can no longer do my regular 2-block walks without fear of falling or tripping. And what really convinced me to decide on this surgical procedure was the realization that my body is starting to rapidly regress as the days go by. One night, I almost fell on the stairs with a dizzy spell, similar to a feeling of a vertigo. And finally, I realized that there's no way to fight this battle except to embrace the new changes in my life with regards to the impact of a possible surgery. I immediately consulted with my neurosurgeon who scheduled my posterior cervical laminectomy with fusion on my C4, C5, and C6 vertebrae scheduled for July 1st. However, as we were barely in May of 2020, where the COVID-19 virus is at its peak, the procedure was held in abeyance pending the outcome of the increase of virus cases that needed urgent care and treatment. So, what did I do to prepare? The very first thing I did, as I mentioned, was I went through Google and YouTube and watched a lot of videos and read a lot of documentaries about people's experience and patients' past experiences in their surgical procedures. I listened to several surgeons and watched their YouTube documentaries. I also watch and listen to patients, past patients who has undergone their first day, the first 3 weeks, or the first 6 months, or the first 12 months of after their procedure. What was very helpful in my search was the YouTube video by Dr. Gary Simmons. He's a chief neurosurgeon at Carilion Clinic, where he shared different ideas that are very helpful in my understanding of the procedure, why my procedure is so important, and a picture of my road to recovery after surgery. He also discussed about the several imperfections of the surgery and gave me some bleak ideas on what are the negative impacts of the procedure. One of the things I did to prepare was I had a haircut, and you can see, very short. And yesterday at 7:30 in the morning, I had my COVID-19 test, and today I received a call from Kaiser Permanente that my surgery is on for tomorrow at 7:20 in the morning. So I have to be at Kaiser Fontana at 5:30 for check-in. There are several things I prepared myself with. One of them is, of course, my cell phone and my charger, a small wallet that has my ID and my insurance card. I brought some good stuff with me, underwear, small couple of t-shirts, jogging pants, and of course, a book. I'm also bringing with me a pair of sandals, my medication, and of course, my neck brace, which I will be expected to wear after the procedure. I guess that's all for now. My surgery is on for tomorrow, and I'm excited and at the same time scared. And however, I will be giving you guys an update from time to time as soon as I'm able to do so. I hope that you will be able to tune in, and I look forward to seeing you in my next video, which will be within a day or two after my surgery, or when I'm ready to do the next video. Please wish me luck, and I also wish you the best on your personal journey on your upcoming surgery. Don't worry, you and I will do great. Remember, in this surgery, all you need now is trust. Trust in your surgeon, and most of all, trust in God. I would like to share with you this wonderful prayer that my brother Dennis shared with me. As it goes, I invoke the blood of Jesus Christ to bless the mind and the hands of my surgeon and his team, who will help me through a successful surgery. And I pray for God to hold my hand in every step of this wonderful, challenging journey. Take care, and I will see you soon. Bye.